Hi all. So I chose the paper of short syndrome, which is the 6-month follow-up on 11-year-old boy for my general club. So here is an abstract of the paper. So this is the report about the follow-up case report done on the 11-year and 2-month-old boy who is having short syndrome with severe insulin resistance, which is diabetes type 2. So the short syndrome and type 2 diabetes is basically caused by PIK3R1 gene. And the people who is having short syndrome and all with the insulin resistance, there's no treatment for like insulin resistance with the people having short syndrome. And so the people who did work on this paper gave that 11-year-old boy a live intervention and the two medications, which is metformin and pioglitazone, to decrease the insulin resistance. And and they did a follow-up after 6 months, which resulted in decrease in the insulin resistance, and the therapeutic strategies did make some like positive changes in boys' health. Here's the introduction of the paper. So short syndrome is autosomal dominant genetic disorder. And there are some specific characteristic of short syndrome, which is like triangular shaped face. And you have like a big forehead, ocular depression, which means your eyeballs are like way too inside, the short height and very thin nostrils. And you have like small chin and the teething is delayed. So according to the report, there are very few cases on short syndrome, but out of that few cases, 90% of the cases showed the gene mutation in PIK3R1 gene. So what is PIK3R1 gene? So PIK3R1 gene encodes for kinase, phosphatidylinositol 3 kinase, which is PIK3, and it is with the regulatory subunit of P85 alpha binding to the catalytic subunit of P110 alpha. And then this activates the PIK3 gene, which plays very important role in chemical signal transduction within cells along the cell growth, insulin resistance, and most importantly, in protein synthesis. In this report, the mutation of PIK3R1 gene was found, which was diagnosed as short syndrome. The follow-up was then approved by Ethics Committee of Kido Hospital of Shandong University. Here is the picture of 2-year-old boy that is suffering from the short syndrome. So here are the characteristics that you can see for like big forehead, the ocular depression, small chin, like very small nostrils, and the shape of the face is like in the triangular shape, and it's a bit weird than the normal ones. So here's the materials and method. So here in this case, as we talked before, that this is the case report, and which is the follow-up after the 6 month that is carried out on 11-year and 2-month-old boy who is having short syndrome. So the boy had complained of like blackening of like skin folds, which is neck, armpits, pubic area, and any other skin folds. And it's been there since last 10 years. So the physical examination was taken before the treatment, and that was before 6 months. And the results were like height was 160 centimeter, weight was 64 kg, which give out the body mass index is 25 kilogram per meter square. And there was also dark discoloration on neck, armpits, pubic area, and other parts of skin folds. And the patient in this case report did not have specific symptoms that are found in the patient having short syndrome. So like triangular face or ocular depression was the things that were not found in this patient. But the patient was checked for insulin and glucose levels, which was 14.5 after fasting. And there was also oral glucose tolerance test taken, which was 75 gram, which stated that the patient had normal glucose level, but the insulin was higher than in the normal person, which is also known as hyperinsulinemia. And all these symptoms suggested that the patient might have type A insulin resistance. And exome and the sequencing was carried out, genetic sequencing was carried out, which showed that there was there was mutation in PIK3R1 gene, and the mutation was frame shift mutation, which caused the premature stop of protein synthesis. And no family history was found on the patient. The patient was adopted. There was no family history found. The major insulin gene were also tested for the mutation, but no mutation was found. But there was an insulin receptor that had a missense mutation. And according to echocardiogram, there were no previous or current pulmonary or heart disease found. Patient had mild or less hearing in his left ear, and according to their eye exam, it was stated that the vision was decreased and there was increased intraocular pressure in the patient's right eye, but there was no dysplasia. So like there was no completely blind. So dual energy X-ray absorptiometry of the assessment of the body composition was done. So basically the body fat was calculated, which was 28.5%. And the lead and the height square was like 47.3 centimeters square. And patient's body fat was like 28.5%. Visceral fat area was 47.3 centimeters square, and lean upon height square was 14.5. And therefore, the patient was diagnosed with the SHORT syndrome. So here is the picture showing the frame shift mutation in PIK3R1 gene. So here the T gets deleted, and so it caused the frame shift mutation. This is deleted, and so the protein after this changes, like till here it's H, and then now it changes. The C is now deleted, and now it changes to V and the S. Here is the heterozygous deletion. So the mutation, that is mutation of PIK3R1 gene, the sequencing. The patient, and there was the result, and then was the results. So the patient had severe diabetes type 2, and the life in which the lifestyle intervention was carried out did give the positive impact on baby's the 11-year-old boy's life. So with metmorphin, the patient had severe diabetes. So the result showed. Okay, now let's talk about the results. The result showed the patient had severe diabetes type 2, and the lifestyle intervention that was carried out gave the positive impact on the 11-year-old boy. So the lifestyle intervention was carried out with metamorphin, that was 1000 milligram per day dosage, and pioglitazone of 30 milligram per day dosage. And after 6 months of follow-up, it was found that the body mass index did not increase so much. It was only like 23.54%. And the result of glycated hemoglobin was 5.3%, and the insulin resistance was 4.1. And the oral glucose tolerance test result was also carried out, which showed the huge decrease in hyperinsulinemia. Here are the graphs that show the results before and after 6 months of life intervention. So here the red graph shows that the blood glucose was like high, and then it suddenly went down. But after like life intervention, it became normal at 6, and then it didn't like it first increased and then it started going down gradually. Here is the insulin release curve. So before the treatment, it was like very high. But after the treatment, it's like low and normal. Here is the C-peptide release curve, which also shows decrease. Here is the discussion. So after the diagnosis of the short syndrome in the patient, the after the so here is the discussion. So after the diagnosis of short syndrome in the patient was the first in the family and phenotypically by the laboratory findings. And in patient PIK3R1 gene, the heterozygous pathogenic variants were found, and they were by genetic testing, and there were 11 heterozygous pathogenic variant were found. And in the beginning, no specific physical characteristics of short syndrome were found in the patient. And so the researchers, the people who did work on the paper, they took it for granted and thought the patient might be having type A insulin resistance with normal glucose tolerance, but that was not the case. One of the symptoms of the short syndrome is sensory neural hearing loss, but the patient only had like mild hearing loss in his left ear. The eye exam, the ophthalmological exam results were decreased vision on the right side and increased ocular pressure on the right eye. But the glaucoma is the common characteristics that is found in the short syndrome, and the mutation in PIK3R1 gene is the main cause of the short syndrome. And so, as I told you, 11 pathogenic variants were found in the 11-year-old boy. And the frame shift is the resulting in premature termination of the protein synthesis, which is I would say the main cause of the short syndrome in the 11-year-old boy. And here is the amino acid that is getting changed. Here is the DNA nucleotide that is changed. And here is the conclusion of the report. So in conclusion, it was identified that there is a heterozygous mutation found in PIK3R1 gene in an 11-year-old boy that is having short syndrome. The patient had severe insulin resistance, which was diabetes type B, without having any clinical symptoms of short syndrome. And the lifestyle intervention with metmorphin and pioglitazone, which was carried out for 6 months, which resulted in decrease in the insulin resistance and which gave the positive impact on the 11-year-old boy. And here is the boy who was having, is the 2-year-old boy who is having short syndrome. And that's it. Thank you so much.